ডাক্তারানী,
হ্যাঁ
টাইম তো আমাদের হয়ে গেছে। স্যার, দেবাশিস বাবু, স্যার, দিদি স্যার।
স্যার, তাহলে শুরু করছি।
দেবাশিস বাবুর সঙ্গে একটু কথা বলে নি।
হ্যাঁ
স্যার,
স্যার এটা লাইভ হয়ে গেছে, লাইভ হয়ে গেছে স্যার।
হ্যাঁ, গুড মর্নিং এভরিবডি।
গুড মর্নিং স্যার, তাহলে শুরু করছি।
শিওর।
ঠিক আছে।
অমরদা, গুড মর্নিং।
হ্যাঁ, গুড
গুড
আফটারনুন।
আফটারনুন। হ্যাঁ, ভালো আছেন?
হ্যাঁ, ওই চলছে গো।
হ্যাঁ,
তুমি ভালো আছো তো?
হ্যাঁ, আছি ঠিকই
আর
আছে।
মেয়ে ভালো আছে?
মেয়ে ভালো আছে, মেয়ে
আচ্ছা।
ভালো আছে।
ওকে, চলো ডাক্তারানী, শুরু করো।
Very good afternoon, Honorable Principal Ma'am, President, the Physiological Society of India,
নমস্কার।
respected resource person, colleagues, and the audience. On behalf of the organizing committee, Department of Physiology, Baharampur Girls College, and the Physiological Society of India, I am honored to welcome all of you in the 3-day national webinar on COVID-19, Fighting Together and Moving Forward. On this occasion, I would firstly like to request Ms. Ritama Sinha, student of 5th semester in the Department of Physiology, Baharampur Girls College, to inaugurate the webinar with the opening ceremony song. Over to Ritama.
বহে নিরন্তর অনন্ত আনন্দ ধারা, বহে নিরন্তর অনন্ত আনন্দ ধারা। বাজে অসীম নভ মাঝে অনাদিরব, বাজে অসীম নভ মাঝে অনাদিরব, জাগে অগণ্য রবি চন্দ্র তারা, বহে নিরন্তর অনন্ত আনন্দ ধারা, বহে নিরন্তর অনন্ত আনন্দ ধারা। একক অখণ্ড ব্রহ্মাণ্ড রাজে, পরম একুশে রাজ রাজেন্দ্র রাজে। একক অখণ্ড ব্রহ্মাণ্ড রাজে, পরম একুশে রাজ রাজেন্দ্র রাজে। বিস্মিত নিমেষ হাত বিশ্ব চরণে বিনত, বিস্মিত নিমেষ হাত বিশ্ব চরণে বিনত, লক্ষ শত ভক্ত চিত বাক্য হারা, বহে নিরন্তর অনন্ত আনন্দ ধারা, বহে নিরন্তর অনন্ত আনন্দ ধারা।
Thank you, Ritama, for your wonderful start to the webinar. Now I would like to request Dr. Hena Sinha, Principal, Baharampur Girls College and Chairperson of the Organizing Committee of the webinar, to kindly deliver the welcome address. Over to Dr. Sinha. Dr. Sinha, can you hear me?
Good afternoon to all of you. Am I audible, Daksani?
Yes, ma'am, you are audible.
Okay. Good afternoon to all of you. At the outset of the August 3-day seminar titled COVID-19 Fight Together and Moving Forward, I, on behalf of Behrampur Girls College, heartily welcome all participating patrons, valued speakers, associate members, organizers, and others. I thank all for their sincere endeavors to make it a grand success, particularly when this great occasion has become a webinar. We all know, and it is exaggeration to say, that COVID-19 has taken the reign to reign over the world. And there is no mention of the tenure of this reign, of this failed disease. Under these prevailing devastated circumstances, let us solemnly pledge to terminate this lethal disease by virtue of concerted efforts. Our means may be variant, but end is one. That is to nip the COVID-19 in the world. I hope our sacred endeavor would not end in fiasco. I would fail in my heart. I would fail in my solemn duty if I do not acknowledge from the core of my heart the services, cooperation, and inspiration extended to us by the Physiological Society of India to carry forward our mission. We look forward to getting such act of kindness for the days to come. Once again, I thank you all, and I thank you for being with me and giving me patient hearing. I therefore, without much delay, announce the official opening of the webinar. Thank you.
Thank you, Dr. Sinha. Now I would like to request Professor Amar K. Chandra, UGC Emeritus Professor, University of Calcutta, and the President of the Physiological Society of India to kindly say a few words. Over to Professor Chandra.
Thank you for your nice introduction. Good afternoon to all. First of all, I convey my regards to Dr. Hena Sinha, Principal of the College, the participant in this 3 days webinar, COVID-19 fighting together and moving forward. I convey my wishes to Dr. Ratan Tripathi, the convener, and also Dr. Daksayani Mahapatra for her nice introduction and closely associated with this webinar. You are well aware about the Physiological Societies of India, and the participants are also well aware about the Baharampur Girls College. Physiological Society of India and the Baharampur Girls College are too much close together. Physiological Societies is an age-old society. It has been established in 1934, and since then it is looking after the scientific work associated with the physiologist in the country and also abroad. It has about 800 members throughout the country, and since the inception of COVID-19, the Physiological Societies has organized a number of webinars in this series. Earlier, the associates were Department of Sports Science, University of Calcutta, Midnapur College, Autonomous, and the other institution wherein many dignitaries have given their lecture. And in the 2 days webinar, there are many dignitaries like the eminent Professor Devashish Vandavat, Professor Sanjit De, Professor Nilkanto Chakraborty, and many others. And I believe that it will be a successful one, like other scientists of different categories, other social activities. Everybody is fighting against COVID-19. Physiological Society of India is no less than that is. So it has also utmost effort. So I like to say something regarding COVID-19. In the very situation of the COVID-19, the scientists have great responsibility to solve the problem. But to solve the problem is not at all easy. Till today, the process for which the COVID-19 develops in a particular person is not well known. When the disease or when the pandemic is not well known, then the community, the people are asking the scientists to bring its solution. It is very difficult. At the same time, the problem has not analyzed. When the scientists are trying to analyzing the problem, at the same time, they are asking for its solution. So to do both the work at the same time is very difficult. In the meantime, lots of things has happened, like vaccines, like medicines, and so on. Vaccines is very important, and many countries of the different laboratories are working together to combat it. But according to the experts, that to develop vaccine within this short period, within 1 year, is not at all possible, according to expert opinion. In addition to that, there are lots of drugs are coming in the market or in the laboratory, and they are not at all promising. They may be promising or may not be promising. Vaccine may come or may not be come. But the society or the people want it. It is a very difficult situation for the scientists. And if the scientist can develop certain drugs or vaccine in the meantime, the people will trust on the science and the scientist. But if the prospectus result does not come, then it will be a devastating situation, especially for the scientist. I believe in this situation, some important solution will come, and in this 3 days deliberation, there are lots of dignitaries, there are lots of scientists who are eminent in their field. They will enlighten the participants in this regard, regarding its possibilities, regarding its consequences, and so on. So, on behalf of the physiological societies, I convey my I convey my heartfelt thanks to the organizer, principal madam, and all the scientists who are participating in this situation, and also the participant. Their patient sharing will make our make our work praiseworthy. So, with these few words, I like to conclude. Thank you all. Thank you.
Thank you, Professor Chandra. Now, with due permission from Principal Ma'am, Baharampur Girls College, and Professor Chandra, President, the Physiological Society of India, we would now request Dr. Anup Kumar Korok, Head, Department of Mathematics, Baharampur Girls College, to kindly introduce and launch the e-abstract book.
কভারটা আমার দেখাচ্ছে না।
It's okay. That's what I mean.
Yes.
ও ওখানে পড়ায়। তো সুন্দর করেছে।
Okay, just enough. Lakshani, please continue.
Okay. Thank you, Professor Korok. Now I would like to state our first resource person of the session is Professor Devashish Bandobadhyay. And I would like to request Dr. Sriti Ratan Tripathi, Head, Department of Physiology, Baharampur Girls College, and convener of the organizing committee, to kindly introduce Dr. Bandobadhyay.
Thank you. Lakshani. In the ongoing year, just before introduction, I want to say something. In the ongoing year, we are in the 75th year of the college. On the auspicious occasion of Platinum Jubilee of the college, Department of Physiology is going to organize a 3-day national level webinar on COVID-19, fighting together and moving forward, starting from today. Eminent scientists and faculty members from several institutes in India and professional persons like doctors, lawyers, and mental health professional persons are going to deliver their valuable lecture on different aspects related to COVID-19, the newest pandemic disease. It is our moral duty to learn and educate the general common population, including our beloved student communities, about the present pandemic disease and how they can overcome this situation. It is also a great achievement to us that the Physiological Society of India has extended their hands to cooperate with us. Now I like to introduce our respected sir, Professor Devashish Bandobadhyay. Dr. Devashish Bandobadhyay is presently professor at the Department of Physiology, University of Calcutta. Before joining the University of Calcutta, he was the founder head of the Department of Biotechnology, Assam University, Silchar, Assam, India, followed by head Center for Biotechnology, Vishwabharati University, Santiniketan, Bolpur, He did his PhD work at CSIR Indian Institute of Chemical Biology, Calcutta, and his postdoctoral work at University of Texas Medical Branch at Galveston, Texas, USA. Professor Bandyopadhyay has been working on melatonin since few decades and has made significant research contribution on melatonin in the domains of enzymology, oxidative stress and free radical biology, myocardial ischemia, gastric ulceration, which have been recognized world over. Moreover, he was also made an impact in the field of development of new drugs or antioxidants of synthetic or natural origin. He has national and international collaboration and has published more than 110 research papers till date in national and international peer-reviewed journals. Professor Bandyopadhyay is a regular reviewer of numerous leading journals published by Elsevier and other internationally renowned publishers. He is one of the editors of the journals Cardiovascular Regenerative Medicine and Melatonin Research published from USA. Professor Bandyopadhyay is a recipient of prestigious Porimal Vikas Sen Memorial Oration Award from the Physiological Society of India, Calcutta. Sir, please.
Thank you. Thank you, Sriti Ratan. না বলছি শেয়ারই হচ্ছে না। দেখছি
কোনো অসুবিধা হচ্ছে স্যার?
একটু মানে শেয়ার করতে অসুবিধা হচ্ছে, দেখছি বাবা না।
স্যার আপনি যেটা শেয়ার করছেন ওইভাবে করুন আরেকবার।
হ্যাঁ
একদম।
আমি নতুন করে চেষ্টা করছি।
হ্যাঁ, এবার এই গুগলের ক্রোমটাকে মিনিমাইজ করে দিন।
ক্রোমটাকে মিনিমাইজ করে দিচ্ছি। হ্যাঁ,
এবার আপনার নর্মাল পাওয়ার পয়েন্টটা ওপেন করুন। এবার উপরে দেখুন এনেবল এডিটিং আছে।
হ্যাঁ, এনেবল এডিটিং আছে।
ক্লিক করুন, এবার F5 মারুন, এবার F5 করুন।
F5 আচ্ছা, শিফট টিপে কি
না, অ্যাকচুয়ালি আপনি নিচে ওই স্লাইডিং এ যেতে পারেন, একদম নিচে দেখুন জুম যেখানটা আছে, ফুল স্ক্রিন যেটা হয়।
হ্যাঁ
হ্যাঁ হ্যাঁ হ্যাঁ, একদম
ঠিক আছে তো,
রেডি স্যার।
দেখতে পাওয়া যাচ্ছে? দেখতে পাওয়া যাচ্ছে?
হ্যাঁ স্যার, দেখতে পাওয়া যাচ্ছে।
আচ্ছা, থ্যাংক ইউ।
স্ক্রিনটা দেখতে পাওয়া যাচ্ছে?
হ্যাঁ,
স্ক্রিন দেখতে পাচ্ছি না।
হ্যাঁ স্যার, সব ঠিক আছে একদম স্যার, বলুন।
সব ঠিক আছে তো? আচ্ছা,
একদম স্যার, একদম।
First of all, good afternoon, everybody, and thank you, Sriti, Ratan, for your invitation that I have accepted early. And also, I like to thank you, Principal Madam of Baharampur Girls College, who, despite all these difficulties, have agreed to organize this webinar. And my special respect to Professor Amar Chandra, President of Physiological Society of India and our senior colleague. And thank you all for inviting me to share some of my experiences with melatonin. Before I start the lecture on the topic therapeutic potential of melatonin for the management of COVID-19 disease, I would like to share some of my very interesting experiences. During early March, when the pandemic when it was just declared a pandemic, I received one invitation from editor-in-chief of a journal named Melatonin Research to write a review on melatonin and COVID-19. So then I replied him that neither I am a virologist nor I am an epidemiologist. So would it be justified for me to write the review? So then again he returned with a letter that based on your experiences, you have enough experiences gathered for more than 30 years. We request you to apply your experiences to write on this particular topic. Then we started writing, we started searching the literature, tried to understand the mechanisms both of COVID-19 disease as well as where the knowledge of melatonin stands in this particular area, and finally prepared the manuscript, completed it, and submitted it for consideration by the journal. It was reviewed by 3 internationally well-acclaimed reviewers and was accepted and published in end of May. I like to inform you that it was the first paper of its kind published on the topic on melatonin and COVID-19 for the first time from India and for the first time from University of Calcutta. So we must all take pride of this. We must all share the pride of this, that this was the first paper published from India on the topic of melatonin and COVID-19. So much so was the popularity of this paper that since first week of June 2020, it remained till today the top rated paper in the Google Scholar, ResearchGate, and Euromed, which is a literature search engine for European Union scientists and researchers. So based on this success, I was invited by Madhpur College, who were organizing at that time a webinar on COVID-19 and COVID-19 and oxidative stress, human management. Then I accepted their invitation and gave my experiences, shared my experiences with them. And this is the second time that I am sharing the experiences. And I must thank Sriti Ratan, who remembered me for long days. And I think he will remember me for long days to come. And I also thank Amarda, who might have had a very good discussion with Sriti Ratan about my selection as the first speaker of this webinar. So my thanks to both of you and also Principal Madam. So as you can see, the topic is clear: therapeutic potential of melatonin for management of COVID-19 disease. So first, I'd like to have an introduction about this. Melatonin, all of you know, particularly the young researchers, students, that it's a miracle molecule. It has 4 or 5 years back, it has completed 50th years of its discovery. Melatonin, which is chemically known as N-acetyl 5-methoxytryptamine, has now been recognized globally as an ubiquitous molecule found in almost every creature, diatoms, bacteria, plants, and animals, including humans. During the course of organic evolution, melatonin never changed its structure and thus is a well-conserved and an ancient molecule in nature. Since the discovery of the antioxidant properties of melatonin by Dr. Russell J. Reiter, I think Amarda can remember Professor Reiter visited our university and our laboratory on January 2007, and Deng Xian in 1993, the role of melatonin as an antioxidant in various situations of oxidative stress in animals, plants, and humans has been well established. It is now clear that melatonin has evolved much earlier in comparison to the other antioxidants. Melatonin is uncommonly effective in reducing oxidative stress under a remarkably large number of circumstances. It achieves this action via a variety of means, that is, direct detoxification of reactive oxygen species and reactive nitrogen species, and indirectly by stimulating antioxidant enzymes while suppressing the activity of pro-oxidant enzymes. In the structure of melatonin, you can see there is a methoxy group, which is very important. Be it toward binding of any receptor with this group, or this CH3CH or CH3CO group or acetyl group. These two are responsible for antioxidant scavenging of free radicals and binding with the receptors. But at the same time, receptor binding activity, this NH function is also very much important. So what is novel coronavirus disease, or what we popularly call it now as COVID-19? Coronavirus disease, that is COVID-19, is an infectious disease caused by a newly discovered coronavirus. SARS-CoV-2 has infected hundreds of thousands and killed tens of thousands of people worldwide after being first reported in Wuhan, Hubei, that is in Hubei province of China, in early December 2019, which was later declared as a pandemic by World Health Organization in March 2020. It has ravaged societies as well as destroyed fiscal and economic stability of several countries. Although there is no vaccine yet, there are, however, several drugs that were designed for other conditions have been repurposed to counter the COVID-19 pandemic. One such drug being melatonin. I would like to inform you that government of Texas, USA, has permitted a human trial. I think that trial is almost nearing end. That how and why high dose of melatonin can not only be protective against COVID-19, but it can cure. It has already cured hundreds of patients in different hospitals of Texas, and this trial is I think is nearing completion. The mechanism of SARS-CoV-2 infection is the requisite binding of the virus to the membrane-bound form of angiotensin-converting enzyme 2 and the internalization of the complex by the host cell. High mortality rates in severe progression of COVID-19 are predominantly caused by pulmonary failure due to high-grade airway inflammation. Development and progression of acute respiratory distress syndrome, that is popularly known nowadays as ARDS, has been implicated as the likely cause of death in COVID-19. COVID-19 was originally reported as a lethal lung disease with fever and cough as the most common symptoms. However, the increasing number of gastrointestinal symptoms such as diarrhea, vomiting, and abdominal pain in patients have clearly suggested that gastrointestinal tract may also serve as a potential route for SARS-CoV-2 infection. And you will be happy to learn that what are the mechanisms that melatonin employ while giving protection or while providing resistance by the tissues against COVID infection has been very well described in the paper that I will show you later. COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. My primary objective for this lecture is to make public aware of how melatonin can become useful either in preventing or in protecting or even in severe of the cases in curing. But you know, the mechanisms involved in curing the disease is going to be very complicated. Human coronaviruses, including coronavirus disease 2019, can lead to epidemics with high morbidity and mortality. These epidemics emerge and mutate at such a rapid rate that traditional methods of drug discovery cannot keep up. So what to do? There are currently no effective drugs approved to treat COVID-19. However, since viruses depend on host proteins to replicate and spread, existing drugs that target those proteins could prove to be effective antiviral therapies. Drug repurposing, I repeat, the term drug repurposing or the repositioning of existing drugs for new therapeutic purposes could be an efficient and cost-effective approach to establishing prevention and treatment strategies for COVID-19. Melatonin serves as a potential candidate for such therapy. So how melatonin comes to the rescue? Melatonin has been shown to have anti-inflammatory, antioxidant, and immune modulating effects that may be given as adjuvant therapy in patients admitted with COVID-19 pneumonia. Melatonin has also been shown to be protective. Melatonin has also shown protective effects against other respiratory dysfunctions as well, mainly because of its anti-inflammatory and antioxidant properties such as allergic airway inflammation, toxicologically or radiation-induced acute lung injury, respiratory disorders such as COPD, obstructive sleep apnea, neonatal respiratory distress syndrome, bronchopulmonary dysplasia and asphyxia, impaired respiration in sepsis, idiopathic pulmonary fibrosis, and pulmonary hypertension. SARS-CoV-2 induced endothelial dysfunction and cardiovascular injury are probably initiated by increases in the phosphorylation levels of JAK2 and STAT3 and resultant reactive oxygen species formation. These pathological alterations are speculated to be strikingly reversed by melatonin. Melatonin works by reducing, I repeat again, melatonin works by reducing expression and release of pro-inflammatory cytokines such as IL-1 beta, IL-2, IL-6, IL-8, and TNF-alpha, along with its ability to forcefully activate immune cells to abandon aerobic glycolysis. I repeat, with its ability to forcefully activate immune cells to abandon aerobic glycolysis in favor of mitochondrial oxidative phosphorylation. Aerobic glycolysis gives pro-inflammatory activated immune cells, for example, macrophages, an opportunity to produce increased amounts of cytokines which are released as the cytokine storm. The associated significant increase in oxidative stress is accepted as a major contributing factor to the bronchoalveolar dysfunction and pneumonia that occurs in SARS-CoV-2 infected individuals. So this is how the whole scenario looks, that you can divide the individuals in three major categories. Individuals with medical comorbidities, how can they protect themselves? Covering their mouth and nose, avoiding close contact with those who are sick, avoid traveling to affected cities and areas, regular hand washing, and melatonin, use of or consumption of melatonin, slow release tablets from 3 milligram to a maximum of 10 milligram 60 to 30 minutes before bedtime. Elderly people can also use melatonin in a very easy way, and health workers, apart from having other protective devices while they are on work, they can consume melatonin 40 milligram per day, preferably 1 hour before bedtime. This is, the information that came from this famous paper. Is a scheme for prevention of COVID-19 infections in elderly, in individuals with comorbidities, and in healthcare workers, published by Professor Ratan in Frontiers in Medicine. It's a very prestigious journal. So why choose melatonin? It is a common man's question, that if I consume melatonin, will I be safe? And if I am safe, then how much is the protection? How much is the quantum of protection? Melatonin's multiple actions as an anti-inflammatory, antioxidant, and antiviral against other viruses as well make it a reasonable choice for use. Melatonin is readily available, can be easily synthesized in large quantities, is inexpensive, has a very high safety profile, and can be easily self-administered. Because in most of the US continent and European continent, melatonin is sold as over-the-counter medicine. So it can be self-administered safely because of its large safety margin. Melatonin is endogenously produced molecule, so nothing to worry about. It is produced in small amounts, with its production diminishing with increased age. That is the risk, because that when myocardial infarction happens, be it in COVID-19 or in normal cases, it is still debatable that whether the myocardial infarction happens due to sudden reduction of melatonin level in plasma, or the myocardial ischemia causes reduction in melatonin level, is a $1 million question still nowadays. Under the current critical conditions, large doses of melatonin alone or in combination with currently recommended drugs, that is hydroxychloroquine, which many scientists and clinicians say that it's not effective much, chloroquine, or to resist COVID-19 infection would seem judicious. That means the existing drugs are not very effective. Even if you can make a theoretical combination, combining drug X with melatonin, or studying their binding at different locus on the cell. But in practice, this is not going to work. So what I can conclude, till date, huge evidence exists for use of melatonin as single or as an adjunct therapy in the alleviation of a number of diseases arising from oxidative and nitrosative stress. Very recently, researchers have demonstrated its protective role in COVID-19 disease condition by reducing the cytokine storm caused by COVID-19 disease and predicted that humans seem to be safe if melatonin is consumed at a pharmacological dose or consuming melatonin containing food or beverages. Scientists or social scientists must give their focus when they communicate to the people that consuming melatonin containing food or beverages are very important nowadays. Although a number of compounds have shown modest efficacy in resisting this disease, but all of them have significant toxicity. Several pharmaceutical companies are rushing to develop vaccines, but their availability is 8 to 12 months in the future. Thus, in this scenario, as Professor Chandra was talking about, that developing vaccine overnight is impossible. So still we may have to wait for another 6 months to 12 months to get a possible effective vaccine. Thus, in this scenario, melatonin therapy at a suitable dosage of 8 milligram per kg per day. I repeat, thus in this scenario, melatonin therapy at a suitable dosage of 8 milligram per kg per day of melatonin is suitable for COVID-19 patients, especially for the severe cases. This dose is calculated from an effective dose which significantly reduces the mortality of virus-infected mice and is therefore assumed to be effective for COVID-19 severe patients. That's the trial going on in US. As melatonin is currently considered to be a molecule with no side effects, it seems to have a great potential in the treatment of COVID-19 disease as an adjunct therapy in humans at a situation where development of vaccine against COVID-19 disease is still awaited and or unavailability of a correct drug of choice makes the situation more difficult for clinicians to treat this disease which caused a pandemic situation. This is a list of the papers published in the special issue of the journal Melatonin Research on Melatonin and COVID-19. Here you can find, you can see the journal at the website www.melatonin-research.net. And just, Communiques has published a paper on melatonin and cardiovascular disease and COVID-19, a potential therapeutic strategy. Professor Hardeland published a paper on protection by melatonin in respiratory diseases, valuable information for treatment of COVID-19. Dr. Tan has published a paper on estimated doses of melatonin for treating deadly viruses infections, focus on COVID-19. Professor Cardinali is a very famous scientist. High doses of melatonin as a potential therapeutic tool for the neurologic sequels of COVID-19 infection. Professor Anderson published a paper on COVID-19 pathophysiology, interactions of gut microbiome. Dr. Boga has published ER stress and autophagy induced by SARS-CoV-2, the targets for melatonin treatment. Professor Reiter published plasticity of glucose metabolism in activated immune cells. Dr. Lowe has published potential of melatonin in the prevention and attenuation of oxidative hemolysis and myocardial injury from CT147 SARS-CoV-2 spike protein receptor binding. And Professor Castillo has published melatonin as an adjuvant treatment for coronavirus. He is the doctor involved, in fact, in the treatment of these coronavirus patients, corona-infected patients by melatonin. and this has become a very popular paper. And in the same issue of the Melatonin Research Journal, we have our contribution as well. The title is Melatonin as a Potential Therapeutic Molecule Against COVID-19 Associated Gastrointestinal Complications, an Unrevealed Link. First author of this paper is Dr. P.K. Pal, who is a postdoctoral D.S. Kothari Fellow at my laboratory. So thank you very much for inviting me and giving me the opportunity to share some of the experiences with melatonin, which can be thought to be, or which can be helpful in providing treatment to millions of patients suffering from COVID-19. Thank you very much.
Thank you, Dr. Bandyopadhyay, for your wonderful and informative lecture on the potential use of melatonin in the management of COVID-19. Our earnest gratitude for managing some of your precious moments of the busy schedule for us. We hope to have you with us always. Thank you very much once again.
Welcome, welcome. Thank you very much.
Thank you, sir. Moving on to our next speaker of the day, Professor Kushal K. Dash. I would like to request our convener, Dr. Sriti Ratan Tripathi, to kindly introduce Professor Dash.
Yes, Professor Das, Kushal Das is present with us. Professor Kushal Das is the distinguished
Good afternoon.
Chair Professor
Good afternoon.
Faculty of Medicine in BLD University, Vijayapur, Karnataka, and the Dean of Environmental Health, UNESCO Chair, Life Sciences, UNESCO. Professor Das.
Okay. I think Sriti, please. That's enough. That's enough for introduction.
Okay,
Sir, I'm very sorry to cut in the middle. I would like to request Professor Bandyopadhyay to kindly stop presenting the presentation.
Yes, I have stopped it. Oh, okay.
Yeah.
Okay, sir. Thank you, sir. And the audience, if anyone has any question, you are kindly requested to write them down in the chat box in the YouTube link. We would communicate them and get back to the answers later on. Thank you. Over to Professor Dash.
Yeah. Thank you very much. Thank you, organizer. Specifically, first, I convey my sincere thanks to organizing committee, specifically Dr. Sriti Ratan Tripathi. Although I am unwell and I have contacted Sriti Ratan that I am in the home now and in a home quarantine because of my ill health. But I don't want to disappoint my younger brother Sriti Ratan. Hence, I decided to join somehow. My great regards to President Dr. Amar K. Chandra of the Physiological Society of India, Dr. Somnath Gangopadhyay, the General Secretary of Physiological Society of India, the Principal of Baharampur College, and all the distinguished speakers, and my previous speakers, my younger brother, Dr. Devashish Bandyopadhyay, who spoke very well. I heard his talk and I liked it.
Thank you. Thank you very much.
And as I will not able to present and my slides and all, because of somehow I tried through my mobile, but I could not able to manage. So I opened my laptop and I sit and I thought to speak a few words. My dear colleagues, my dear students of physiological sciences, it's a great honor and privilege I consider to speak at any forum under the banner of the Physiological Society of India. I took it as my privilege. As I am working in a medical university setup, we have a big multi-centered hospitals, teaching hospital of the university, where large number of COVID patients are admitted. We initially started with 250 bed dedicated COVID hospitals, converting our super specialty hospital into COVID hospital. But now the situation is such a serious, we have to expand it further. Another 250 beds we have to include under COVID hospitals, which is completely dedicated and isolated from the different parts of the hospitals, because it's a teaching hospital under a medical college. The situation is so alarming. Almost every day we have around 150 to 200 admissions, although equally same numbers of patients are discharged. 75% of COVID patients in our hospitals, it's a district tertiary centers, so we get patients from surroundings. We noticed that initially the number of patients from rural sector were low, but unfortunately last 2 months we are finding quite a good number of patients are coming from remote villages, distinct villages from my district and the neighboring district also, because it is one of the biggest hospitals in the entire North Karnataka. So that indicate the situation going wrong. So somehow the recovery rate is high, and as we cannot afford the number of patients in-house, so we are making the system to quarantine in different places. And now we are only have an option for home quarantine. So around 75% of the patients are home quarantine, and 15% of the patients at the moment are in a very precarious condition. They are in the general room or general bed in the hospital, under COVID hospital, but not exactly in ICU facility, only oxygen facilities are given. Around 11% to 12% are in ICU, and of which around 4% to 5% are under ventilators. So this is a real scenario. I'm telling it from my own institution, in which I am one of the part and very important administrative part also. The thinking that as I have a responsibility as a Dean of Environmental Health under UNESCO Chair Life Sciences, so I decided to speak a few words with this background of COVID situation in a reality of a medical school where COVID patients are under treatment and care. We have initially thought that COVID might have cleaned the environment, as green environment was a dream of everyone, and everyone is aspiring that should be a completely smokeless environment where you can enjoy the life. Initially, it was done very well. We found the smokes has reduced, but the same situation is not there. Under the banner of UNESCO, we have organized 10 weekly UNESCO meetings under UNESCO headquarters Paris, of which I was a coordinator. So many countries, including US, Canada, Sweden, Switzerland, Russia, Eastern European country, Asian countries like Iran, Pakistan, India, Bangladesh participated. The scenario is very unique as far environmental concerned. We found initially that perhaps the environment make the COVID spreads. And also we found equally that COVID-19 make the environment again a dangerous situations, both-sided. Most of the people, they speak on how that COVID-19 had an impact on environment. But simultaneously, we found how environment also have an impact on COVID-19. So it's a vicious cycle. So in this cycle, certain aspects must be discussed. First important point is, which the reason I started my talk in a hospital scenario, that tremendous impact of biomedical hazards are really the threat of environment due to COVID-19, which common people must understand, and also the policymaker, management, including hospital management, doctors, healthcare workers must understand. In our hospital scenario, we have a 1,250 beds hospital, including 250 beds super specialty, which is now COVID hospital. Normally, our biomedical waste products usually comes to not more than 10 ton per day. And this is a city, we have 4 lakhs, near 4 lakhs population city. And as it is a tertiary center, so district around the population, I can remember, it should be around not more than 50 lakhs all the district together. So we have around 10 ton critical biomedical hazards come from the surgical waste and other waste, etc. But in this COVID, where literally the patient input from others reduces, now we have around 500 COVID patient every day, and around 250 patients are maximum at the moment are hospitalized, because majority of the patients not comes to the district hospital, and we are managing it through M-Health, mobile health, or which is also called e-medicine or telemedicine system. But we have popularly we have a very well set up of the mobile health networking, which is connected to the districts. We have a rural centers, then the subdivisional centers, healthcare of public health centers, through which through mobile health we are communicating. So patient input is reduced, patients are not coming as such. So hospitalizations also reduced, because except the emergency trauma and some of the critical operations which is super specialty it belongs to, which we cannot avoid, like a neurosurgery, one among them. Cardiac surgeries and all we have stopped, and we have sent to the referral Bangalore for the higher. But we have reduced the number of patients hospitalization as such. But what we noticed that our biomedical waste disposals from 10 ton, it is now nearly 100 tons per day, where patients numbers are reduced. So this is a factor in one of the hospitals I'm talking about. I think in Calcutta or any major city, it is more than our situations and our condition. So where it goes, we normally have an incinerator system under Environmental Pollution Board. They control it, regulate it, monitor it. So most of the biomedical waste, including forensics, the post-mortems, all usually disposed through incinerator. Now, because of the COVID, some restrictions are there from the pollution board. So hence, the control regulatory mechanisms make it well in advance what to be disposed. So many of the things are actually undisposed, stay for a long period of time. So this is making a hospital a concern. And these materials, we have seen that we sterile it and all, but our microbiology department and Department of Immunology of our hospital, we notice that disposed substances which have not been properly disposed, kept it for series of disposal as the procedure of pollution, we found there is the virus exists, because we have a COVID testing laboratory under ICMR, which is NABL accredited. So this has made an alert that where the patient will ultimately and how it will spread, because there are huge number of, we have 250 doctors in the hospitals, plus we have around 150 to 200 interns. Nearly 150 into 450, we are having postgraduate student doing MD and MS. So such a setup. And now for the COVID treatment, the routine protocol which you follow as per the guidelines to keeping the environment free and to safe and safety of the doctors and all, there is a very interesting way we have to monitor it. Each of the COVID duty doctors, because COVID ward is completely isolated, blocked, and it has only visualized to the CCTV from outside. Even the superintendent, other management people, they operate from there. Each of the corner, very restricted zones. So there are no people can enter. So in this condition, keeping in the mind, the doctors who does the work on COVID duty, they usually does it for at a stretch 10 hours, 8 to 10 hours. One person is kept for 24 hours as a reserve for alternations if somebody really feels sick, a doctor. So doing this every 3 days, each of the doctor goes for quarantine. And after again come back from 3 days quarantine, they go for 7 days house quarantine and then again come and join. So you understand why so many doctors are required in a hospitals and a setup. I think this is every hospitals of a medical college setup. This is going on. At least in Karnataka and our all hospitals are running in this way. So this means we require a huge number of medical doctors, equal number of the nurses and paramedical staffs. Now, when they use the devices and safeties measures, including face shield to others, all the things are now done. And this cannot be repeated for the second patient once, because there are 2 patient zones we have kept in the hospital. One are suspected results yet to arrive, but patient is a critical. So you have to provide them facilities, but you cannot take them considered to treat the antiviral treatment because they are not confirmed COVID. So this situation, there is a zone, again in the safety zones, but not directly COVID, but by the semi-COVID zone. That is also kept. And so doctors who are doing the duty for the COVID zone, they cannot go to the semi-COVID zone and treat because they are still suspicious. Maybe antigen test has positive, but it should be confirmed by antibody plus real time. So this needed time. So this is the way then goes. So all things are separate. Each time they have to change their uniform, their dress, and all the safety personal protection equipments, and including mask and all. That makes a havoc, and that is one of the reasons nearly 10 times it is increased, where the patients are 50% reduced in total number of hospital patients. Patient reduction 50%, but waste of biomedical gone to, and operations and all major operations are stopped. In spite of that, waste materials has gone 10 times higher. This is an environmental impact. And this is to be going on if COVID does not stop. It has been reported when in our UNESCO meeting, we find the same situation in other hospitals in Italy or even in the Spain, when we, in the meeting, the doctors who are attended, which I was coordinating. Similar report also from the China and also Bank of the Thailand and all. Their oceans are full of musk, full of biodisposal substances. People just dump there. Same happens when you use a mask or face shield. Face shield we may not be using in the home, but mask everyone we are using, gloves also we are using. Now where we are throwing it? Are it going proper way? Is it properly disposed? We are not sure, because as for the pollution control, environmental factor was the least priority by any of the governments still so far governed in our country. Even I surprised when I communicated in the meetings in the UNESCO for 10 meetings, nearly 2.5 months, we find Western European countries are also behaving in the same way. So this is one of the facts really we think that need to be worried, and how this waste management can be controlled and regulated, that history will tell. So this is one of the part I want to share with you. The next important part is the socio-economical environment. So socio-economical environment is really matters. Lot of people lost their job, and even the crime rate has been reduced, but suicide rate has been increased. There are a lot of people that committed suicide in Bangalore, in our another important place where the software is very important is in Hubli, Dharwad. So we find from Karnataka, there is a quite number of young people has gone. They have gone just because of they lost the job, family members, beloved ones. So this is the sociological perspective, and this environment is now completely different. And we do not know that how much benefit is the social distancing is, because we have the two great examples. One is Italy, where people are too much social. Another is Sweden, where people are exactly not at all social in that aspect. In my own experience, I have visited both the countries. I have seen that Italian people are very much club and fond lovers. Equally, they are very much homely. So they stay in the home. And the population in the places are scattered, but where they're dense, they're thickly dense. Whereas Sweden, peoples are not stay in like that way. Sweden are only singulars. Most of the peoples, the population is very low, and peoples are less married. They stay in a single. So social distancing they have not followed, but they did not have a disastrous effect as social distancing has been followed in Italy, which they have it. So various factors it comes. Really social distancing all the time, it is matters or not. So density of the population is factors. Even in the village, we have noticed the patient who come from our village sites, they do not have any social distancing at all. They just stay in a small room, or they stay in the along with the cattle and all. So there is no environment them to keep the social distancing aware, and neither they have a knowledge base also. So this makes one interesting part, that how these people will be coping up, or how these people will fight against the COVID. And we find that India is showing a disastrous pathways in this regards, because our village is now infected. It is community spreads. So that was the worry initially. Now it is already started. And we do not know when second peak will come, what will be the phenomena. So we notice these factors that I will not discuss about the too much of economy. I think many people will speak about that. And I will not discuss too much about the problems and issues pertaining to the working from home environment that my beloved friend, Dr. Gangopadhyay, a renowned ergonomist, will speak about that more authentically. But I want to say that these factors are really worrisome, how we will be going for it and how we'll do. Third important environmental health factors that we must be concerned. This is not exactly our country as such. During UNESCO meeting, we noticed this is one of the OD factors for European countries, because they use the renewable energy. Their socioeconomic points have come in a different way now. Because of the COVID, and the employment of any of the European countries, the employment is very less as such, because population is less, employment is also less, and there are many things they have to provide systematically, so they cannot take unorganized way employment. So employment is less. Now, European country, most of the countries, they're depending on the renewable energy for their day-to-day survivals and day-to-day work. Now, COVID has made a devastating effect on that environment, because the people lost the job, or people left their places, or they have been fired. So that is the reason the alternate energy like hydroelectricity and all projects are greatly affected. That's what the Austrian and Hungarian peoples, Switzerland people, they have reported to the UNESCO, their scientists, that this is an issue they're facing, because they started using once again the burning the other resources, gas fuels more in the home. So what we think that they are using less motor, but motor has not gone, motor still is in the home, so it may be used tomorrow. But think that we are not traveling, because flight we are not using, but don't waste, but that will be again there in the tomorrow. But fuel is not gone. So these fuels are now used for the alternate source of energy, which is actually emitting carbon. So that was the first time we heard in the European counterpart of the UNESCO's, when they said that they are facing this problem because renewable energy sources have been declined nearly 10 to 20%. And that is the reason they're feeling, and they're having a sensation of an environmental disaster if it continues for a long period of time. So this is another aspect we have discussed. Another or last point which I want to say, that environmental factor is also very interesting works for the COVID-19 cases, which I have jointly worked with my counterpart at La Paz, Bolivia. This is in high altitude places, which I have a collaborations. So in this place, our joint works on high altitude and COVID-19 with my great friend and pulmonologist and director of Institute of Pulmonary and Clinical Pathology at La Paz, that is the capital of Bolivia. We have noticed a very interesting observations. In Bolivia, there are lower zone, that is the Amazon started from there and entered in the beginning flat zones. They have a very big city called Santa Cruz. That is almost sea level. And high altitude is the La Paz, the capital city, which is 3,500 meter to 4,100 meter altitude. I visited last year. This city is population around 28 lakhs. Similarly, Santa Cruz, which is the second biggest city next to the capital, also 26.5 lakhs. Interestingly, it has been found that COVID-19 patients are 100 times higher in Santa Cruz than La Paz, because there was, which I said just now, the population density, one of the factors which makes the environment in a different way to handle the COVID-19. In these cases, we have studied, have found that Santa Cruz and La Paz, though their altitude population is same, but COVID-19 is 100 times lesser in La Paz. So high altitude environment might have given a benefit. So the works, actually, when one article has been published in the Respiratory Physiology and Neurobiology Elsevier journal, one has just been accepted in reviews on recent clinical trials. So these articles, we have mentioned how environmental factor, high altitude environmental factor, it helps. But very interestingly, when we studied in the Ladakh Leh regions, we find they have a quite good number of COVID patients. So there is a possibility of contamination from high altitude or the movement of the troops and other outside people. So this is an environment where people-to-people communication restriction, it looks like that it needs to be done. But again, somewhere it looks that it does not matter. There are some other factors may also matter. Unfortunately, till this date, neither the medicines or treatment line nor the vaccines are available. So we have to only depend on our conventional treatments, which we really follow, normal treatments and all, and try to see as best as possible to keep our environment clean, neat, and as best as possible. As I am in the home quarantine, I can do it because I have small family and I have multiple rooms. But in the same my city, other laborers and other poor people where they work, they have slums. They have stayed even in the small 1 or 2 room with a more number of children. How they will maintain the self-quarantine and quarantine? As I told, at the moment, we have no other alternative. We have to send them to quarantine because we don't have the hospital beds as such. India has not prepared for the COVID. Most of the country might have not prepared, but India was the worst among them. Absolutely, the healthcare system, like education sector, were badly neglected. And I think that government must rise up and it will definitely think in the new era of post-COVID. So with this, I'd like to end my talk. I apologize to all of you, but not showing any slides. Just I have spoken from my own experience. I wish all the best for this conference, and I wish all the best to everyone. Thank you very much. Thank you, Dr. Sriti Ratan, to invite me. Thank you very much.
Thank you, Dada.
Thank you.
Thank you, Professor Dash. I would like to request our convener, Dr. Sriti Ratan Tripathi, to kindly introduce our next speaker, Professor Somnath Gangopadhyay.
Professor Somnath Gangopadhyay is a professor in the Department of Physiology, University of Calcutta, and also in charge Occupational Ergonomics Laboratory, coordinator Sports Science Department, University of Calcutta. He also being awarded the Ramendra Sundar Sinha Memorial Oration by the Physiological Society of India and Professor S. Subraman Memorial Oration by the IABMS. He is actively involved in renowned international societies like International Ergonomics Association, South Asian Association of Physiologists, and International Commission on Occupational Health. He was treasurer and assistant secretary of Indian Society of Ergonomics, and presently he is one of the executive committee member of Indian Society of Ergonomics. He is the secretary of Scientific Committee on SME and Informal Sector of International Commissions on Occupational Health. He has been elected as a member of Ergonomics Section, Bureau of Indian Standards, Government of India, and also the expert member of the Committee of Rural Biotechnology of Department of Biotechnology, Government of West Bengal. Currently, he is acting as the consultant editor of the International Journal of Occupational Safety and Health, associated editor of BMC Musculoskeletal Disorders, and also served different national and international journals as a member of the editorial board. Moreover, sir is our honorary general secretary of the Physiological Society of India. Sir, please.
Thank you, Sriti Ratan. Thank you, Dr. Tripathi, because it is an official program. So I have to, I have to say officially the thank you, Dr. Sriti Ratan thank you, Dr. Tripathi, for introducing me, for nicely introducing me. But I should thanks also my friend Kushal. Kushal gave a very excellent lecture, that is the positions of the India and and also the world positions in the COVID-19 situation. So first of all, I should say a few words about our society, because we belongs to our society that's a very old society, but I should say it's not the old, it's a very young society, young in heart. So we should think about our society. And I should thank Sriti Ratan and Dr. Tripathi that this is the second time he is organized under the banner of PSI, the conference. And this is the webinar, of course, the previous one was the conference. But this time I found a very interesting thing in case of the, this webinar, they have selected a very interesting topic, that fighting together COVID-19, fighting together and moving forward. So that should be our slogan of the day, that we should fight together and we should move forward. So these are the conditions when we have to work from home, or we have to do our work from, at our, just we leave our own workplace and we enter, we living at our home and doing work at our home. In the situations, we are fighting in this COVID-19 situation. So today I'm going to give a talk on this situation, that is the COVID-19 situations and the working from home. So first of all, I should give thanks, convey my thanks to the organizers to call me over here to give a talk on the very specific topic of the COVID-19 and in the pandemic situation. So I will take only 1 minute time to share my screen, and then we'll go for the the actual talk. Maybe it is less than 1 minute. Okay, thank you. So today my talk on this topic, that is the working from home under COVID-19 lockdown and ergonomics perspective. So first of all, the work from home in 2019, there was a survey was made by the Buffer, and in this survey, they find that most of the workers, most of the people, they want to work from home, that is work remotely. Work remotely at least part of their time for the rest of their careers, and they want it in 2019. So 2019 is a quite different situations from the 2020 situations, And in 2020 situations, when another survey was made, then it was found that the survey was made on 52.9% of the respondents. They're from the different organizations like the Google, Facebook, Amazon, Apple, LinkedIn, Walmart, and they're facing loneliness. So the situation has quietly changed from 2019 to 2020, that is in the COVID-19 conditions. They're feeling loneliness. So working from home is the initiation of the loneliness. And I used to say that work from home or working from home is the result of this, this COVID-19 situation. So when we bound to work from home, that means we bound to, it's not our, it is not our, we are very much interested now to work from home. We bound to work from home because we have to earn. And when we have to earn, then because if we don't want to work from home, don't want to do this work from home, then there's a losing of job will be there. Then we may lost the job. And when we lost our job, then it will be very difficult for the conditions. Then the very difficult situations we have to face. So that loneliness is a very important thing, is a very important result of this 2020, the COVID-19 situations. So I should quote the Microsoft CEO Satya Nadella that this culture, this work from home culture, may have adverse effects on people's mental well-being. So we are mentally very much upset, and this upset of the mental conditions creates some loneliness. So mental stress have been developed. Not only the physical stress, but also some mental stress has been developed. And in the next line, I should quote from the Satya Nadella that video calls are fine for interim period, for the short period, but this cannot be considered a replacement for in-person meetings. So these in-person meetings, because Indians are very much social. It is that punishment that we have to stay at home and we don't want to mix with our friends and other also the relatives, because when you have to work from home, then that means it is very difficult for us to mix with our own relatives during working from home. And this is another study done by India.com, and the report was published in the July 22nd, 2020, that 74% of the people in India say they will continue to work from home more than they did before the COVID-19 pandemic. So now it's a very interesting situation, that 74% people, they express their willingness to work from home, after the COVID-19 situations also, after the COVID-19 conditions, after the COVID-19 pandemic. But, but the most important thing is that the 91% of the respondents in India, they agree that they have increased their use of laptops during the pandemic. That means they're bound to use their laptop. They're forced to use their laptop, their computer. They're forced to work from home. And this is the very interesting conditions because there's some fear of losing job is there behind the work from home culture. And this is another study made by the Times of India in June 18, 2020, that and again, it is a very interesting finding, that a majority of the companies have reported increased productivity during the lockdown. That means lockdown is not a bad situation, bad conditions. It is that the increment of the productivity is there. The productivity has increased during the lockdown situations. But the second line, if you go to the second line, go through the second line, then you will find the anxiety, stress, and fatigue have also been increased. So this is the actual situation, work from home or actual situations in the COVID-19 conditions in India. That means there's some anxiety has already developed, stress has already developed, that there's some probability of losing job if we don't want to do work from home, then there's some possibility of losing job is there. And then we bound to work from home, and then we try to increase the productivity, because that productivity is the main concern of our organizations. So now our health conditions is going down, and at the same time our productivity is increased. So it is a very interesting study, I should say. And the side effects of work from home, now we will find that insomnia, backaches, restlessness, and the stress and anxiety is there. And I should quote from Suresh Sharma, a Delhi-based techie, said that he spends most of his time either in front of his laptop screen or on his mobile phone. That means it is very difficult to end the job. Previously, we used to do 8 hours job. Now, that 8 hours job has already turned into 10 to 12 hours job. Because it is very difficult to, just to switch on from one place, switch off from one place, and then switch on in the other place. So, this is the conditions, because, again, the same thing is the losing of the job and the back problem. He developed already the back problems and the headaches. So these back problems and headaches, the main reason of these back problems and headaches is we're using the computer or using the mobile phone or the smartphone for longer period. So longer period of work create this anxiety, this problem. And this is the 27th August 2020, the report of the print, that India is not ready for a work from home model. And the most interesting thing is there's no policy of the work from home in India. So we should first build the policy, and then we just try to implement that policy among our workers. And then we can do some things. But now there's no policy of the work from home in India. And we don't have any proper workstations at our homes. That's the very interesting part. Because we bound to work, we have to work. Because if we don't do work from home, then there's some probability of losing job is there. Then we'll become jobless. And we have to be bound to, we're forced to work in a situation, in the conditions which are not designed proper. So proper workstations is not there. And we have to do work from home. And this is advertisement what I recently found from in my email. And when you just click over this, then you will find 100, then you will find 100, then you will find hundreds of furnitures over there. But whether these furnitures are actually giving you comfort or not, because we have to sit on the furniture, we have to use this laptop or desktop or the smartphone over there, and these conditions actually create some stress on our body, and then it will be difficult for us to do work for a longer period. So where is ergonomics over here? Yes, ergonomics is here. Ergonomics means there are the two Greek words. One is the ergon and the nomos. Ergon means the work and the nomos means the laws. If you want to increase your productivity, then you have to maintain some law during your work. And this laws means natural law. So you have to maintain the natural law during your work. So now the bending of the back is not the natural law. But when the back will become straight, you can say just that time we are maintaining the natural law. So this bending of the back means if we are bound to work from home for longer period, sitting on a very bad furnitures, then we may develop the back pain. And this back pain means the development of the musculoskeletal disorders, and ultimately, that will decrease your productivity. And now you want to increase your productivity in these postures, and unnecessarily your health will be deteriorated. So these conditions will create some problem, actual problem, and our health, because we're bound to work in these conditions. So ergonomics we have to, if we use ergonomics in the work, then ultimately we can improve the productivity, and at the same time we can maintain our health. Because the three most important things are very much related with the ergonomics. One is your capabilities, your strengths. Second one is your limitations, and the third one is the requirements. So when we think about your strength or capabilities in the work from home conditions, then we should think about the furniture, design of the furnitures. Whether the furniture is very heavy, then it will be very difficult for you to move from one place to other place, to lift the furniture from one place to another place. And the limitation is your body dimensions. And your furniture, if it is not fully matched with your body dimension, if your furniture will not match with your body dimensions, then you will feel discomfort by sitting on that furniture and doing work for longer durations in that particular posture. So these are the limitations, and the requirements is also very important. Requirements means that is when you have to work from home with computer. Then this monitor, this placement of the monitor is a very important thing. Placement of this keyboard is also very important thing. Placement of the positions of the mouse is also very important. So if these things will not be placed properly, then that will create some problem on you to work from home. So these are all the conditions we have to think when we're bound to work from home. And this is the actual situations of the work from home in future, that 56% of the office employees will work from home in the future. But I should add some more things, some more percentage over here, that it should be 80. But because that presently that 85% of the total population, they are working from home. So in future, maybe 90% of the office employees will work from home. So a huge populations will work from home in future. And these 63%, they feel that they are more productive when they're working remotely. The same things, as I already showed you, that in the 2019, it was the feeling of the people that we are more productive if we work from home. So this is again the concept of the 2019 situation, that the 63%, they feel they're more productive when they work remotely. But now it is found that when we bound to work from home, then actually we need 30 to 45 days to get productivity to the same level as working from office. This 30 to 45 days is the most important thing in case of the working from home. But why we need 30 to 45 days? Because we don't have proper sit or proper stand workstation. Because work from home means we are getting comfort of the home, but actually we're not getting comfort of the home. Because we're bound to work from home, and it's very difficult for us to mix with our family during working from home. It is very difficult for us to mix with our friends, as normally we used to mix with our friends during our office hours, and after office hours we used to mix with our family. family members. Now it is very difficult for us to mix with our family members, with our friends. So some mental agony, some mental stress, some physical stress develop when you're bound to work from home in this condition. So the health condition is a very important thing. And we already developed this work-related musculoskeletal disorders. There are several work-related musculoskeletal disorders we have already developed, like carpal tunnel syndrome, tendonitis, muscle strains, etc., etc. And when we try to apply this ergonomic controls means that if there is no ergonomic controls, then there will be the proper postures will not be there. The improper posture is the lack of ergonomic control. So by the ergonomic controls, we can give them the proper posture during working from home. The keyboard height is the very important thing. The monitor height is also very important thing. The chair adjustment and the rest. The rest is the very important thing during the working from home. And when we think about the work-related musculoskeletal disorder, I should mention about this person, the Bernardino Ramagini. First, he gave us some concept of the work-related musculoskeletal disorders. And in this book, that is the diseases of workers, in this book, he gave some 300 to 400 musculoskeletal disorders, and which are very much related with the different occupations. And he said that the posture is a very important thing by which the person may develop the musculoskeletal disorder. All the excessive movements of the body is a very important thing. And the postures means the awkward postures, the constrained postures. Because we bound to work from home, then it will be very difficult for us to count the time, and then we have to sit in a constant posture for a longer period in a particular situations, and that will create severe problem at the back, which is known as the back pain, or the excessive movements due to the improper positions of the screen, of the monitor, of the keyboard, of the mouse. Then these excessive movements also create the musculoskeletal disorders, and that musculoskeletal disorder, we should say these are related with the work, so these are the work-related musculoskeletal disorders. So these are all the musculoskeletal disorders. These are actually the soft body tissues injuries in the different parts of the body, and these are all the musculoskeletal disorders we may develop, and we already developed when we have to work from home. The most common musculoskeletal disorders, I should say, this is the lower back pain, and also the shoulder pain, also the upper back pain, the elbow pain, the knee pain. These are all the very common musculoskeletal disorders we have developed. And what are the stressors beyond this? Yes, the poor and awkward postures. That's the number one stresses. And this poor and awkward postures is very much related with the design of the furniture. Static muscle loading. We're bound to work from home in a constrained postures for longer period. Due to the improper positions of the mouse, keyboard, and the monitor, our repetitive task is there. And other factors are also, the illumination, level of the illumination is very important things in case of when we have to work from home. Sometimes it may develop some glare, and that glare, due to the glare, it will be difficult for us to work from home for a longer period. And the working desk, the monitor, the keyboard height, and the very, very important thing is the chair adjustment. So chair is a very important thing, whether we are using this particular is the proper chair at home or not. So these are all the things are very much related, and you can say these are all the ergonomic controls. So I will discuss all of these things, and in which way I will suggest I will give you some tips in which way you can change your workstation at home, and you try to, and then you may prevent the development of the musculoskeletal disorders. So chair is a very important thing, and this chair, that the 5-point base. So when we just select the chair to work from home, to work at home, Then you have to find out whether the five base points are there or not, whether there's some adjustable lumbar or back support is not. So these are all the factors we have to consider. And this is the chair, and this is the sit pan. And if this sit pan, the cushion is very soft, then again you will feel some discomfort at your back. And this is the proper positions of the back. And if this proper positions of the back will not be there, you will not get proper support of the back, then you develop the musculoskeletal disorders, all the back pain, severe back pain. These are all the chairs. These are fully adjustable chairs, and these are very costly chairs, very expensive chairs. And sometimes it is very difficult at home to use this chair because, as it is 50,000 or 1 lakh rupees, this cost. This is again the adjustable chair. This is not the, when we sit over this chair, then your back will become straight. Again, for the longer duration to sit over this chair, it is very difficult thing. The backrest is required over here. This is a lumbosacral region. And when we get the backrest over here, then only then we'll get comfort. Otherwise, we'll not get any comfort during the working from home. And normally we have to work from home. During work from home, we normally we sit on the floor. And when you sit on the floor, then again we think that in which way we can get comfort, in which way we get comfort at the back. Now I will give you some suggestions. If we bound to work from home and we have to sit on the floor, then the backrest is required over here. There's a lumbosacral region. Like here, the cushion. You may use some cushions, some soft cushions, not so soft, not so hard type of cushion, and then we'll get the proper backrest over there. And you may use this type of desk and can place your laptop and the notebook over there so that you will get some comfort. And this inclination is a very important thing in case of the work from home. This inclination of this desk is very important thing, and this inclination is very much required. And I will give you some idea why this inclination is required. And when the person is using this phone, this smartphone, then his neck, the twisting of the neck is there. And if he use some headphone over there, then this twisting of the neck will not be there, and then the person will feel more comfort during work from home. So placement of the monitor is a very important thing. The monitor should be placed in such a way the person will not get some glare. That will eliminate the glare on the screen and also on the eye. Because if the window is in front of the person, then the direct sunlight will fall on the eye. But the window should be at the side, and the monitor should be placed directly in front of you. So if this monitor is not placed directly in front of you, then there's some twisting of the neck will be there, and which is known as the tension neck syndrome. So if the monitor is straight, then there will be no twisting of the neck. There will be no probability of development of this tension neck syndrome, and the person will feel maximum comfort during working over there. And the top line of the screen at or slightly below your eye level. That's like 30 degrees below your eye level. And then you will feel some comfort. Then excessive movement, excessive bending of the neck will not be there. And if there's some excessive bending of the neck or the twisting of the neck, that means you may develop the musculoskeletal disorder at your neck. And when you have to use these two monitors, then the two monitors should be placed in U shape. So the minimum amount of neck movement will be there. And you know that if we place it properly in U shape, then there will be no neck movement, because both the monitors will be inside your visual field. But if the monitors are placed like that, then there's some frequent movement of your neck or of your body will be there. And if these two monitors will be placed, in U shape, then there will be minimum movement or no movement of the neck will be there, and you can, because it is under your visual field, and you can see the both monitors at the same time. And what about the keyboard? Yes, keyboard should not be in such a way that that there will be excessive bending of the wrist will be there. So the wrist will be straight. There's no wrist will be straight. In this photographs you will finding that wrist is not straight, but wrist should be straight, because in these conditions the person may develop carpal tunnel syndrome. That again, another type of musculoskeletal disorder. And the keyboard should be placed directly in front of you. So the mouse and the keyboard should be placed at the same level. If the mouse and keyboard are placed in the two different levels, then the probability of development of the musculoskeletal disorder is very high. The shoulder pain will be there. The two different levels. Then you have to move your arm over there to hold this mouse, and to use the keyboard, you have to down your arm. So in this condition, the person may develop the shoulder pain, that is the shoulder tendinitis over there. So it is a very important thing. And there are so many keyboards out there. And here the design of the keyboard is such like that when you have to use these keyboards, then your wrist already, normally your wrist will become straight. But again, these keyboards are very difficult to find over here, number one. And number two is very expensive. So there's some hundreds of keyboards and you can use these keyboards. But again, it's very difficult to find over here. This is a mouse, and when you use this mouse, this type of mouse, your wrist will become straight, and then you will get the comfort during using these things. So these are all of these things are about the monitor and the keyboard and the mouse. Now, what about the laptop? There's a very difficult design problems in the laptop, because in the laptop, screen attached to the keyboard. Screen is fixed with the keyboard. Now, it is very difficult to remove the keyboard from here, because if it is fixed, then you have to adjust your arm, you adjust your screen, and the keyboard are fixed. Then you have to adjust your neck, you adjust your arm or your wrist over there. So again, it is very difficult conditions, and sometimes, and most of the times, you develop the neck pain, the wrist pain, which is known as the carpal tunnel syndrome, the tension neck syndrome, we already developed, because this is a design problem. So now we can I can give you some suggestions that you should use some external devices like the external keyboard, and this keyboard will be fixed with the laptop. And now this keyboard can be placed in the different part, like on your lap or in the other part of your desk, and then you will get maximum comfort over using this type of things. The chair is a very important thing. So you have to find out the proper chair that will match your body dimensions. Now there are 10 or 12 chairs normally we have at our home, and you have to select the proper chair. Proper chair, sometimes it is not properly proper chair. It is not perfectly proper chair. But again, you have to find out that chair which is somehow match your body dimensions. And the laptop screen, the screen of the laptop screen should be back. You should place it's the back. It's some angle should be there in the laptop screen, so that your eye, the top of the eye, there's top of the screen, there's some 30-degree angle will be there, and minimum amount of neck deviations will be there. And the positions of the laptop. Here you found there's some inclined positions of the laptop, and when you use the inclined position of the laptop, then normally your wrist will become straight. And then the possibility of the development of the carpal tunnel syndrome will become very minimal. And this is the adjustment you can buy, you can purchase. Yes, some amount of money you have to spend. But you can use some fat book over there, place some fat book and place the laptop like in inclined positions. And then automatically your arm will become straight. So this fat book, you can find this fat book. Of course, you will find this fat book at your home and you use this fat book. And the most important thing is the movement of your body. You should not sit for longer durations during working from home. So you have to stretch, you have to stand, you have to stretch, you have to work. That means you have to take some rest. I know there's very difficult things when a person has to work from home, but you have to make it like a regular plan. And in case of the smartphone, again, there's a possibility of the development of the musculoskeletal disorder. It's a very important thing. And this is known as the overuse of the smartphone. And when you use the overuse of the smartphone, normally this is our posture, and this is very dangerous posture. You have to bend forward in this case. This should be your posture during when you use when you're going for the use of the smartphone. Then this should be your posture. Then your back will become straight. But here there's some forward bending postures, and this forward bending postures of the neck also. And you know that when you're bending on neck, that means like 60-degree bending. That actually we are carrying the 27 kg of the load of our head. So that means there's some excessive pressure created at the neck. So that means that if we change the posture, we should change the posture from here, from this way to that way. Then we may get some comfort during using the smartphone. And again, the holding and the shuffling with our thumb is a very important thing. And this base of the thumb, when we continuously shuffling with our thumb, then there's some probability of the development of the Dequirevent syndrome is there. That means severe pain at the base of the thumb. And there's some bending at the wrist, bending at the elbow. There are so many diseases like carpal tunnel syndrome, tennis elbow, the golfer's elbow, you may tell. So what is the solution over here? In which way we have to use this smartphone? Yes, of course. The most important thing, you should take break. You should not use cell phone. You should not use smartphone for longer durations. You should take break. But now, again, it will be very difficult conditions. Because as I already mentioned from the very beginning of my talk, that it is very difficult to end my work. When I just switch off my laptop, then I going to switch on my smartphone like that. Because every time there's some fear inside the mind that anytime my boss may call me, may give me some official work, then I have to work from home for a continuous thing. So there's no 8 hours job. It's not 8 hours job. It's some 10 hours, 12-hour jobs in India. So take a break is very difficult situations, but we have to take some break and use voice sometimes. If it is not, you should use your voice because it will prevent to develop some the Dequirevent syndrome. And the same things by the using of the stylus. But the most important thing we can do like that, we can we can change the hand. Sometimes we have to hold the smartphone with the right hand and sometimes with the left hand. In this way, we can do these things. And the most interesting thing is the sitting and standing workstations. There's the changing of the postures. We have to change our postures, frequent. And then sometimes we have to sit and work. Sometimes we have to stand and work. So our workstation should be sitting, standing workstation like that. And in which way we can get it at your home? Yes, you can use your kitchen. And in this kitchen platform, you will get that benefit that sometimes you can sit, sometimes you can stand, and you can do it. And this is the most interesting rule. That is the 20-20-20 rule. The 20 minutes, every 20 minutes, you have to take 20-second break and just look 20 feet away. And then you will get some mental comfort, some physical comfort. And I should say, you will not get only the physical comfort, but also the mental comfort by using this 20-20-20 rule. It's very simple. No cost is required. And sometimes in my whatever suggestions I've given you, some minimum cost is required. But again, you will get maximum comfort by working from home during working from home. So these are all the stretching exercise you have to do. You have to take some break during your work, and you have to do the stretching exercise. And then the stretching exercise will give you extra comfort during working from home. And you should make a plan on this way so that every time you will get, the comfort during working from home. Because in future, I do not know how long we have to work from home, but these conditions maybe will be continued in future also. So we have to follow these rules and ultimately we get comfort.
we come to the end of the first session of the day, and I would like to state that we will resume our next session at 5 p.m. sharp. Thank you.
Thank you, sir.
হ্যাঁ, থ্যাংক ইউ।
Thank you, sir.
সরি, এখন it is recording. Okay.
Okay, no problem. No problem, sir. No problem.
ওকে। না, আমি
Thank you.
যেরকম আমাকে বলেছিলি, আমি হয়তো বলেছি কিছুটা about your conference and other things. Whether it is ঠিকঠাক হয়েছে তো আমি বলছি, আমি সেটাই।
Very, very fine.
Okay, nice.
রেকর্ডিংটা স্টপ স্টপ করে দিলে ভালো হয়।
Right. It is very much required. Stop হয়নি, কিন্তু তোরা এটাকে করতে পারবি। দেখানি তোকে আমি বলছি, তোরা এটা করতে পারবি কি, এডিট করতে পারবি। হ্যাঁ, তোরা এডিট করে দিবি, পরে যখন করবি এডিট করে দিবি, যখন দেওয়ার লাস্টের কথাগুলো এই ঠিকঠাক হয়েছে তো, এই সব কথাগুলো। ঠিক আছে। আচ্ছা, কুশল আছিস? কুশল, হ্যালো। এই কুশল তো কোথায় যে চলে গেল। থাক, ছেড়ে দে। কুশল এখন কোথায় ঘুমিয়ে পড়েছে বোধহয়। দেবাশিস, সব ঠিক আছে তো? সঞ্জিত, রাত্রিবেলা দেখা হবে 8:30টার সময়।
স্যারের অফ করা। স্যার, আপনি কেমন আছেন?
আমি খুবই খারাপ। তুই ভালো আছিস? অনেকদিন পর তোকে দেখলাম।
হ্যাঁ স্যার, ডিবি স্যার, এসডি স্যার, আপনাদেরও অনেকদিন পর দেখলাম।
হ্যাঁ। চন্দন, ভালো আছো তো? চন্দন?
হ্যাঁ স্যার, ভালো আছি। আপনি ভালো আছেন?
হ্যাঁ রে, চলছে মোটামুটি।
স্যার, আপনি অনেক রোগা হয়ে গেছেন।
আমি রোগা,
আপনিও হয়েছেন আর এসডি স্যারও রোগা হয়ে গেছেন। ডিবি স্যার আপাতত ঠিকঠাক আছেন।
না, এসডি স্যার, আমাদের ডিবি স্যার ঠিক আছে, কিন্তু
ডিবি স্যার আপাতত একই রকম আছেন।
না, শোন না, আমি সকালবেলা মর্নিং ওয়াক করি। অবশ্য সকালবেলায় সবাই মর্নিং ওয়াকই করে, অন্য কিছু তো করে না। আর সন্ধ্যেবেলা ইভিনিং ওয়াক করি। আর মাঝখানে মর্নিং ওয়াকের পর ঘরে ঢুকে আমি মর্নিং ওয়াকটা করি ছাদে, বুঝতে পারছিস তো? তারপর আমি ঘরে ঢুকে আমি যোগা করি, এবং আমি রেগুলার যোগা করার জন্য আমার ভিতরে একটা অদ্ভুত একটা শক্তি ডেভেলপ করেছে। আমি বুঝতে পারি মাঝে মাঝে, সেটা টের পাচ্ছি। আর সেই জন্য তোরা আমাকে রোগা দেখছি।
সেটা তো খুব ফিল করছি আমরা। তার কারণ
ইউটিউবে লাইভ হচ্ছে, আমরা রিলিভ এখন ছেড়ে দিচ্ছি স্যার।
আচ্ছা,
এখন ছেড়ে দাও, আমরা এখন যাচ্ছি। টাটা, বাই বাই, আবার দেখা হবে। দেখা হবে আবার। দেবাশিস, বাই। হ্যাঁ, দেখা হবে 5টার সময়। চন্দন দেখা হবে। কুশল, যাচ্ছি রে।
থ্যাংক ইউ।
ওকে।